Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in ophthalmology. Discover a new show at itube.net/podcasts. Welcome to the second part of a two-part special series of the Mod Pod, Contact Lens Business and Patient Safety in the COVID-19 Era, Redefining Normal. Dr. Rachael Wruble speaks with colleagues Drs. Brianna Rhue, William Toe, and Justin Weigel about their optometric practices and contact lens business, all in the context of the ongoing COVID-19 pandemic. In the second part to this series, we covered topics of telemedicine, maintaining staff morale, patients worried about lens scarcity, and preparing for future pandemics. But before we do, we would like to take a moment to mention this program is not possible without the help by Bausch & Lomb. The opinions and views expressed during this program are those of the individual participants, and are not necessarily those of Bausch & Lomb or its affiliates.
We even had one staff person I have 12 staff total. One did not come back, and she was a young, healthy individual. She was just very concerned about safety and working with patients. She's like, I don't think, some patients are taking this seriously. So she resigned, and even though we talked to her, we're going, this is healthcare, I can't change that. And she was a technician, so I couldn't really change her to a different position at the time. So she resigned, which was a bummer. We had to replace her, even though we went through our whole protocol that we're following very, very closely. Have you guys experienced that with staff at all? How are they all doing?
I was surprised.
Go ahead, Justin.
Oh, no, I was going to say, I was kind of surprised. We have kind of a younger staff, but they were very diligent in the beginning. I didn't expect as much fear out of them, but they'll tell me, no, I'm not going to let this patient in unless, they wear their mask right. And so, okay, whatever your comfort level is, that's fine. But yeah, we haven't had a whole lot of kickback. Sorry, I didn't mean to cut you off there, Brianna.
Yeah, same that my staff has all been really rock stars. So we're all, it's in, seeing half the patient load feels like we've seen quadruple the patient load. So everybody at the end of the day with all the protocols is just exhausted. So it's figuring out how to keep them motivated every day to keep coming back and giving their all. So, because there just is no timeline for when this is all going to be over. I think that's what we're all kind of struggling with is, for a hurricane, right? We know we're going to be closed for 2 weeks, and it is what it is. So at least we have power, and at least we have internet. The grass is, a little greener there. But that's, I think, where we're all kind of seeing is how do we stay motivated through all of this with the protocols and the constant changes that are happening. So what are you guys doing for your staff to keep them going?
Buy them Chick-fil-A. That's huge here in the South, and I buy my staff Chick-fil-A, and they love it.
Yeah, that's a big Starbucks for us here. They love, in the morning, just that little pick me up there. Be like, and then the best part is if you go get it, because I think it's different if the boss goes out and picks it up for them versus if you send one of the staff. I think it means more that you're kind of like, it's not above you or anything like that, or beneath you, sorry. So yeah, but that's a great thing. Buying lunch every once in a while, especially if you see them kind of, feel like they need that little boost. It's been a big thing for us too. I'm lucky everybody came back. The biggest thing is we had to have a conversation, certainly through the, April and May, almost daily conversation. We had Zoom meetings and things like that for those who weren't there, just because we basically needed to come up with game plans. What are people comfortable with? What do we know? What needs to change? Particularly for our staff members that have young kids who are out of school. It's like, how are we adjusting to this to make it flexible for you? Or the ones that lived with, older parents or grandparents, where it's like, hey, even if I get sick, I'm fine, but I don't want to hurt grandma or grandpa, right? So it was basically everyone who could help out, really, I think did a great job of stepping up to compensate for those who had to take a step back because of their family situation. So I think it was really important to keep that open dialogue. And because of that, everyone was willing to be much more flexible. And like I said, for those who could give a little bit more, they did. And those who had to step back because of their situation, they did. And then we got through it pretty well. And we're, stronger than we ever were because we know that we have each other's backs through a pandemic, which not something you thought you'd have to talk about, 6 months ago, but that's where we're at.
I mean, I completely agree. Having a strong team is going to get us through this all together. Working together is what we need to do right now. And, if this happens again, or, as we're starting to see actually patients call in that have been positive, that haven't been here, but just it's great to have that team kind of jump around it and figure out what to do, what can we do to help. Let me pose a question at you guys. So patient calls, they're COVID positive, they're sick, they are due for an exam, they haven't had an eye exam in a year, and they're a contact lens wearer. What do you guys do?
We're going to go ahead and extend that one.
Extend that one full year supply? Or?
I think it's really important to take a look at that history first. Like, okay, hopefully they've been here for a few years, so I have a pretty decent history and notes. Are they a contact lens abuser? Do they take that 2-week lens and wear it for 2 months? Right? Those are a lot of things where, it's going to be a very specific plan that we're going to do for this very specific patient. Obviously, don't want them coming in if they are sick, and whatever we can do remotely, telehealth or over the phone, let's do it.
I think, one of the things that came out like on the AOA recommendations for wearing contacts after this, which I never really had the conversation with my patients about, don't wear your contacts when you're sick. It was just something that, you expect certain things, and, if you're sick and touching things, that you shouldn't do it. But, kind of the scenario that you laid out, worst case scenario, I think in that situation too, like Will said, you look at the history, but then at that point, if they don't have anything to wear, then, you give them a daily and, go over, this is how you have to handle these. And this, is why we do this. This is why dailies are a better option too, that, you got to be careful with your lenses, even when, especially when you're sick. And this just kind of brings it to the forefront.
And that's, I think, where telemedicine comes in too. So you can get them on with the telemedicine visit. That's where you can, charge them for the visit, and then decide together on the history what you're going to do. So I think utilizing those protocols are very useful. And then going from there, because we're all seeing, the question that we're all asking is, have you been exposed to patients with COVID? And Rachel, you being around hospitals, like we see a ton of hospital people. So we can't deny care to these people, and who knows who's been exposed. So it just, again, comes to those safety protocols, but, take it case by case.
Yeah. And you mentioned, Brianna, telemedicine. How often have you been doing telemedicine while you guys were shut down compared to now?
So I was doing around 2 to 3 visits a day. I have never seen so many foreign bodies in my life. So when COVID first started, I even did like a Facebook Live. I was like, guys, like, wear eye protection. So many branches and trees and metal, and everybody became like a home repair person overnight, right? And so we've never seen, that's where it was like, oh, I got to see you. So telemedicine does have its limits, right? Especially with the eye, and how many people were like, can you see my eye?
Yeah.
Like that's where it was, the lighting is bad and you don't get enough magnification. So it definitely, for styes and things like that, very simple, very straightforward, but eye care is very limited with telemedicine. So especially, is that some sectoral redness that is there a foreign body right there? So we had to come in quite a bit. I was here every day through COVID, seeing at least 2 to 3 patients a day with something. So.
Yeah, I agree with you. The amount of cases, we tried telemedicine, and I would say 70% I ended up coming into the office because I have a red irritated eye. I'm like, great, let's sign on and let's do this. And they're like, yeah, I was grinding metal. I'm like, oh, I'll see you at the office. So, we started making a list of everything we saw. What we see in a year, we saw in almost 7 weeks, which was crazy. And a lot of contact lens infections. So people thought, hey, is it COVID? We're like, no, you slept in them. It's an ulcer. So we did see a lot of that as well. But I feel telemedicine has a place in optometry, and I was grateful. There was some patients, we've had COVID positive, and they're calling in with conjunctivitis. You don't know if it's corona conjunctivitis or other, but I'm going, great, let's you and I screen time right now and not have you in our office. Safety for our patients and staff. So I do like that we do have that aspect, hoping, we're not missing anything. It could be a viral ulcer, dendrite, you just don't know. But I think safety-wise, we're kind of holding off on having those patients in the office. Do you guys think telemedicine will continue now that we're back in the office?
I think some of it too will depend on the restrictions that get put back in place with it, because I know they kind of loosened for, the patients that met the criteria to be able to do telemedicine. But like you said, I mean, it's going to be really hard for optometry unless you have, like remote control, slit lamps where somebody can set in it just to be able to triage and, pick out, diagnose those patients over it. Because you're right. I mean, you're trying to Zoom, tap your phone as much as you can. Well, I mean, and you're never going to get to that point where, so many things look so similar, trying to figure out if it's this or this, and you don't want to misdiagnose and put the patient at, treat them irresponsibly or treat them incorrectly where it's going to cause them more damage than if we would just come in and saw them in the first place.
It's almost faster to just bring the patient in, right? So by the time they get a connection and you get a connection and figure out a time, I think it's easier just to get them in the schedule. And now that we're all busy now with patient care, to intervene with these telemedicine visits just is another thing on all of our plates. Not to mention, now as all these claims are coming back that we billed for, a lot of them are getting denied. So we just did all of this for free. So there's a place for it, and we have to figure out, so we just went to, we're not going to bill your insurance.
The other thing, kind of which I think she was getting to, is the revenue from it is so minimal too, that it's just not, it's not worth it to put in a lot of work on things that we just can't, we can't diagnose and treat by looking at without being in person or with a slit lamp.
Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in ophthalmology. Discover a new show at itube.net/podcasts.
One of the funniest things I've had to do over the past few months is try to teach the patient how to flip their lids over the webcam. That's an interesting part. It's like being able to be like, can you try a little bit harder and move a little bit closer to that webcam so I can see? So it's been an interesting thing. Obviously subcon teams, allergy issues are much easier than say, foreign bodies and things like that. We've saw a big uptick in ocular migraines, of course, since everyone's stress levels and anxiety levels are pretty high. But I think, the result of all this is we definitely see the benefits of telehealth. We see where it's restricted and not really useful in certain situations, but I feel like we're going to keep doing it, but use it more as a triaging type of thing. And for like things that can be done with a quick follow-up rather than the actual exams themselves. So that's how I feel like moving forward, even after, the pandemic is completely over, it's still going to be a part of the practice, though probably not a main part of the practice until things can change with better webcams and better billing and coding. And I can go with it.
I want to get back to a little bit of the safety. And Brianna mentioned earlier, there's not a lot of new insertion removal of contact lens classes and education going on by a lot of offices. I've seen a lot of that on social media where they're just saying, hey, we're not doing that right now. Our offices are doing new fits, but we're doing it in a way where we're not even having to touch the patient, which is my staff loves because it's safety for them. We're setting up an iPad right now and showing a video of how to put them in, take them out, tips, tricks, how to clean them, how to store them. My partner, Dr. Ryan Court, has a video he created on intro wellness that's been just huge help for patients where the staff will be sitting several feet away from them, and we'll have the patients wash up, watch the video, put it in and take it out, and we're like, we didn't have to do much there, and that was a lot faster than us sitting there talking them through that. So that's been a big change I've noticed in our clinics. Brianna, you said you're doing new fits. Have you guys changed any of the way you're doing it?
Same thing. So we are showing them the video, and then they are handling everything from start to finish. And then these are really motivated people, right? So it's making it go faster as well. And I think that's where the motivation factor comes in. We're also a huge myopia clinic, and the amounts of patients now that are now wanting to get their kids into, like yesterday, I did 2 ortho K-fits. So we can't forget about those types of patients as we're moving forward. So again, the new fits, as some of our colleagues aren't doing, you can do it safely. And it's a good time to talk about hygiene, and it is possible. So if you're leaving these people out to dry, it's not a good look for your clinic. So you've got to be safe and conscious, but you also have to provide service that people are wanting and looking for. And now these are lifelong patients. So I think that's what others are forgetting. And as you know, we closed down, our patients could get a hold of us. I think that was huge. There were so many clinics around here that, you know, they're like, I called 8 offices before I got to you because everybody else was closed. So if, heaven forbid, we do go on another lockdown, I think people have to be very conscious that their patients know how to get a hold of them. So I think moving forward, just be aware.
This concludes the first half of today's special episode of the Mod Pod, Contact Lens Business and Patient Safety in the COVID-19 Era, Redefining Normal. We heard more from our panel about the changes in managing their business and employees, and how telemedicine now has a real place in treating patients. Please stay tuned for more, where our guests will continue their conversation about marketing their practices during COVID-19 and how they've been able to cover basic operational costs, especially frontline workers. But before we do, we'd like to thank Bausch & Lomb for supporting this program. Please note that the opinions and views expressed during this program are those of the individual participants and are not necessarily those of Bausch & Lomb or its affiliates. Now let's get back to Dr. Rachael Wruble.
Are you guys preparing for the future for a potential lockdown? Like what changes you would do?
So we fortunately had a bunch of stuff in place already. We had the doctor contact lens in place for reorder, so our patients already knew how to reorder from us. I think that definitely is the future, is that Amazon way of ordering. So if you're not giving a patient a way to order contacts from you easily at 10 o'clock at night, now's the time to not go back to your office and get complacent. Because that's, I think, what my fear is as we go back and we get busy in our day-to-days, there's 3 things you got to go back and do. Get your website up to date with your contact lens ordering system, whichever one you're going to go with. Make sure that your staff is trained to utilize it and start utilizing it. So don't let it just become a dead link on your website, because this is the future. So this has sped everything up technology-wise by 3 to 6 years. So make sure your patients know that you offer telemedicine. We've looked at many different ways for the glasses try-ons. It's still nothing really out there. And if you think about it, Warby Parker and those types of things, if you don't have an app on your phone that you're going to use at least once a month, they're not going to download it, right? So, or they're going to delete it really, really fast. And how often are you, so Will, your exam's tomorrow, and are you going to really go to my website to try on glasses before you come to my office? No, you have your kids to put to bed. You've got, we have to be reasonable, right? How often does your optometrist need to be in touch with you? So we can't forget that happy balance. So as we go back, every person under the sun let me know about their COVID routine, right? So email has become really cumbersome, right? How many emails do we all have in our inbox of everybody's COVID protocol? So you have to be conscious of how often you're in touch with your patients so they don't also get sick of you, but you have to stay in front of them.
I agree with you. It's just a different way. All of our offices, we have to look at what our future holds. We all mentioned our offices are busy, which is great. Have you guys changed your marketing tactics to bring in patients, or is it just the phone's ringing?
We haven't honestly changed anything. We've been active on social media, just making sure that patients are getting updates from us. But, these patients were waiting to come in. Maybe we've been, slightly more aggressive, but I don't think it would have made a difference. I think we had, you guys all ran into it. There's this influx of people that, had waited for so long and still had some reservations, even once they allowed for reopening for routine care, that it's kind of created its own, internal marketing that we haven't had to do a ton for.
I've actually, since mid-May or so, doubled our marketing budget actually, because, like I said, wanting to get the message out there. I was just kind of thinking back about this, around that time. It's like, what are patients thinking about now in terms of their eyes or vision? Like, what are they worried about? Obviously, we talk about safety being the number one thing. So being able to let everyone know, new patients, established patients, that, we have safety guidelines in place. We're following the CDC. We're changing them, every day or every week as needed. So safety, getting that message across is important. And the second thing I was thinking was, a lot of industries, people are working from home, or at least they're just stuck at home a lot more. So I've, been reading articles that people are on their digital devices 50 to 100% more over the past 3 months than they ever have been. So blue light, digital eye strain. So putting more messaging about that has been big. A lot of people have been coming in about that. Even people who aren't, working in software engineers that are really big here. People who, like I said, normally don't use computers have been using it a lot. So they're getting that eye strain. And then obviously as the weather continues to improve, dry eye and allergies are big. So those are my 3 things I've been really hitting in terms of the marketing. And I've been getting a huge influx of new patients. So must be working, I hope. Yeah. Very anecdotal, but it seemed to be, in my mind, kind of what trying to imagine myself as a patient rather than a doctor. What am I thinking about in terms of my eyes, or what am I dealing with? So safety, blue light, eye strain, digital eye strain, and then dry eye / allergy. And like I said, I feel like it's been working really well.
Yeah, so you're looking at it from what the patients are seeing from their outlook. Let me ask you guys as doctors, do you guys think any companies have stood up and have helped out during the pandemic, and that you're noticing more for what efforts they put forward?
J&J's been really, I think we're really kind of leading the charge. And then you have B&L and Alcon and Cooper all kind of came together to help us ban with this free shipping and that direct ship to patient model. So they all have been great on getting these rebates and the digital rebates to our patients. So that's been helpful to keep these sales in the office and then let them know about new technology and upgrading to different technology. So the industry, I hope that they keep us moving forward, but we also have to help them move us forward. So what I'm scared that doctors are going to do is they're going to go back, they're going to get complacent again, and now's not the time to get complacent. And you got to make these little changes and use COVID to push your bar forward and really up your game a little bit. So I think, as Will and Justin and you have, Rachel, have done, we really need our colleagues to help do the same. And we can't keep complaining that the big online retailers are coming after us if we're not putting ourselves and standing up for ourselves and putting those things in place where patients can order from us, right? Quit complaining that you have 1 million verifications if your patient can't order from you at 11 o'clock at night. So you got to make these changes in your office. And that's, I think, where our industry really needs to push forward.
Yeah, I thought Bausch did a couple of really good things as far as offering contact lenses to patients or not to patients, but frontline employees and hospital workers. And then as far as, upping for sanitation, using things like that for sanitizer, just little things like that probably don't get a lot of attention, nationally, I think is, at least in our industry that we know about it, and it builds, a certain amount of pride that they're actually doing this to help out with others. And you see a lot of these other companies with the advent of ID.me that are offering discounts to healthcare workers, like firemen, policemen, things like that. I think it's a really novel concept to help out those ones that are on the front line that can use a break and say, hey, I can go shopping, I can take some time off, and somebody is actually it's instant feedback of people supporting you for the work and the efforts that you're putting in.
Yeah, you mentioned Bosch because they're doing the 1-by-1 recycling program too. So we're putting patients in more and more dailies, and we're concerned about the environment. We're able to recycle those cases and the lenses and have that as an option to protect the environment. So,
yeah, that's a huge program. Actually, I would say about at least once a week, even before COVID, I would get people that I'm trying to convert from a monthly or biweekly lens to daily disposable, and they're hesitant because of the environmental factor. So when I tell them about the recycling program, it's like, oh, yeah, okay, let's do this then. So, it's kind of weird that that's the specific reason. I mean, it's not a bad thing. Obviously, we want to take care of the environment, but it was interesting that that's where they drew the line,
Yeah,
so
I agree with you.
Yeah. Mm-hmm. It's nice to have something like that with Bausch.
Well, you guys, I really appreciate you all being on the call today. This was a great talk about contact lenses, getting back into practice, and being there for our patients. So hopefully we can continue on this trend. But thanks again for being here with me today.
Thank you
for having us.
Thank you, Rich.
Thank you, everyone, for joining us today with these amazing panelists that we've had. I've learned so much, tips, tricks with contacts, with cleaning in the offices, that I'm going to take back to my practice.
Thank you for tuning in to our program today. We'd also like to thank Drs. Wruble, Rhue, Toe, and Weigel for their participation in today's program. This program was supported with advertising by Bausch & Lomb. Keep a lookout in the coming months for the next installment, where we check in on the panel to see how life has changed yet again. The opinions and views expressed during this program were those of the individual participants, and were not necessarily those of Bausch & Lomb or its affiliates.